I think the biggest unmet need in the field is that now we have too much of a good thing. We're blessed now to have so many medications and so many different mechanisms of action that we don't have the science that tells us how to choose which drug for which person. And so this gets into the buzzword everyone is using now is personalized medicine. How do we know of these? I haven't counted lately, but I'm sure it's over a dozen different treatment options that we have, well over that. Um, how do we choose the right drug for the right patient without simple trial and error? And it seems with all the things that we have available now, it seems crazy in 2026 that the accepted method for choosing medication for rheumatoid arthritis remains trial and error. But that's really what it is because we don't have that guidance. We don't have the magic test that will tell us this person needs to have their inflammation blocked at this step in the process, and this person needs to have it blocked at that step in the process. We just don't have that. It is something that's being actively worked on, as you're aware, and that's also exciting work as well. But we're still not where we'd like to be as far as that's concerned.
Yeah, so for RA, I think there's a couple things that are in the works. One is that the medications are fabulous, but at the same time they don't fix everything. So understanding that, look, there's still a gap in care, or that there's care that needs to happen in terms of uh, pain that still is present, in terms of difficulty, like getting around. From weakness that medication does not treat. It treats the pain, but not weakness. And understanding how healthy lifestyles or healthy lifestyle living, whether that's diet and exercise, as well as reaching out to other health providers such as physical therapists, can really make you whole again. So that the medications will get you a long ways, but understanding that it might not be just the medications in that need to happen, but other things. Um, I think that there also needs to be more studies that investigate, how can we best treat people with rheumatoid arthritis in relation to these sort of lifestyle or diet and exercise interventions. There's a lot of interest in this, but funding for this is limited, and there's some people out there doing great work, but this work needs to continue and at a larger scale.